Rheumatoid arthritis is a autoimmune arthritis. It is the most common type of autoimmune inflammatory arthritis. So it primarily affects your joints, but it can affect other parts of your body, like it can affect other organs as well, like it can also affect skin, it can affect lungs, it can affect your heart. Rheumatoid arthritis is basically, it's an autoimmune disease like I spoke before, but the major risk factor for rheumatoid arthritis are any infection which you can have, like any infection can trigger the autoimmune process in your body. Infections like viral infections, especially Epstein-Barr virus infection. Then sometimes tooth infections can also trigger the autoimmunity in your body, and it can lead to rheumatoid arthritis. Genetics is one major factor which can lead to rheumatoid arthritis. Suppose if somebody in your family history has rheumatoid arthritis, has been suffering from rheumatoid arthritis, so the risk of you having rheumatoid arthritis increases from the general population by around 20%. There are some genes, if you have those genes, you are like more prone to getting rheumatoid arthritis. Another risk factor of rheumatoid arthritis is smoking. Smoking is known to accelerate the inflammation in your body, and which can lead to rheumatoid arthritis. Another risk factor is obesity. So because obese people, they have the inflammation is high in the obese people. So obese people are more prone to get rheumatoid arthritis. Major symptoms of rheumatoid arthritis are pain and swelling in the joints. So rheumatoid arthritis usually starts with small joints of the hands, like these knuckles. It starts with one joint, and then slowly other joints start to get involved. Usually it starts with pain and swelling in hand joints or feet joints. Then it can gradually involve other joints like elbows, shoulders, ankles, knees, etc. So these are the main joints which are involved in rheumatoid arthritis. Any joint can get involved in rheumatoid arthritis. Other symptoms which patient has is early morning stiffness, like when you wake up in the morning or after periods of rest, like when the patient rests for a while, maybe he's sitting for a long time, or he's taking a nap in the afternoon. So after every period of rest, there is stiffness in the joints, and this stiffness relieves once patient starts to move a little bit. So many of our patients say that, when I wake up in the morning, it's difficult for me to get up. And once I have taken a hot shower bath, or I do a little exercise, and then I feel better. It is mainly a clinical diagnosis. Like when a patient comes to a rheumatologist examines the patient's joint. We take history of the patient, like since how long the joints have been affected, which joints are involved, and how long the swelling has been there, the stiffness is there any early morning stiffness. So the diagnosis is mainly clinical per se. Like a rheumatologist or a doctor can examine the patient and diagnose the rheumatoid arthritis. Blood tests are not necessary for diagnosis of rheumatoid arthritis, but there are some tests which we use in the diagnosis to assist our diagnosis, but they are not compulsory, or they don't define the rheumatoid arthritis. So blood tests like anti-CCP is used. Anti-CCP is basically we test the antibodies which are present in rheumatoid arthritis. Another blood test is rheumatoid factor. This is again an antibody test. It might be present in some patients, it might not be present in other patients. Then there are some more tests like regular test CBC, which we do to see whether everything is all right, the hemoglobin is good, because a lot of rheumatoid arthritis patients, because of the inflammation in the bones and joints, they tend to have low hemoglobin count. So just to make sure that their hemoglobin is good, we do these tests. And again, we usually do some inflammatory markers like ESR and CRP, which are like the inflammatory markers. If there's inflammation in your body, these tests can be high. And then we do monitor some blood tests, like we monitor your liver test and kidney test to see that everything is okay, like there are no side effects of the medicine. rheumatoid arthritis is mainly managed by disease modifying anti-rheumatic drugs. So these medicines, they actually control the inflammation. The immune system is attacking its own joints. So here the immune system is sort of working in the wrong direction, or it's hyperactive, and these are immunosuppressants which they suppress the immune system to a bit, not as much that it should lead to other infections, but to just that it doesn't attack its own joints. It can only be treated and managed when you have this. So we cannot prevent this disease. If it is supposed to happen to you, it is going to happen to you. You should be on anti-rheumatic drugs because these drugs help prevent joint deformities. So the main tip is to take your medicines regularly, to visit your rheumatologist regularly. Second is maintain your weight. So if somebody is overweight, then you should maintain your weight, because extra weight adds extra pressure on the joints. And as I discussed earlier, obesity leads to more inflammation in your body and joints. So controlling your weight is very important. Yoga and pranayam. There are a lot of research where yoga and pranayam have been found to be helpful in patients with rheumatoid arthritis. So if you can do yoga and pranayam, that is good. A healthy, balanced diet is very important for rheumatoid arthritis patients. So take a healthy, balanced diet and stay hydrated, drink plenty of water. So these are the general tips which I would like to give to my patients of rheumatoid arthritis. Basically, there is no such research which says that certain food increases arthritis pain. Like there is a common myth in Indian patients that whether to eat curd or not, whether to eat vegetables like brinjal and etc. But there is no valid research behind this. Only some patients, we have seen in our clinical practice that some patients, they feel that their pain increases after consuming citrus fruits. Not all patients. So only those whose pain increases after consuming certain fruits or certain food items, you should avoid those food. Rest everything you can have.